Careful is an unusual collaboration between the School of Nursing at Kingston and St George's and Chimera, a theatre company which specialises in making performance about, for and with healthcare professionals and their patients.
So the project explores how performance, so theatre and dance, can help us think differently about the role of the nurse and what those new insights might tell us about the world of theatre, but also about nursing education.
In our first discussions, we talked about providing care to patients and their relatives and about nurses' emotional well-being. I also felt it was really important to look at the value of nurses, as sometimes we're so focused on patient care we forget about caring for ourselves. I've heard nurses referring to themselves as just a nurse.
The project's inspired by my experience of helping my brother Milton go through leukemia treatment. And during those long, difficult months in hospital, we were really reliant on the nurses. They're the ones that helped us cope day to day. So to us, they are not just a nurse.
So I was curious about Alex's idea of combining nursing students and drama students together to look at the concept of caring. The project started in the summer of 2016, and the workshops introduced nurses to exercises that are usually used for training actors. Not to teach them to act, but rather to reflect on how they move and hold themselves, how they approach people, how they look at them, and how that can have a big impact on how they feel.
So I also used those early workshops to research the material for the performance that I was developing in parallel. So I asked the student nurses to talk about their experiences on the wards and how they felt about caring for patients, and they shared many stories about the pleasure they got in doing so, and some stories about being made to feel very valued and cared for by patients themselves. But what I focused on in developing the show were those more troublesome experiences, so moments where student nurses felt they were caring too much and then couldn't switch off at the end of a shift, or where they witnessed other nurses who were just too busy or exhausted to give the quality of care that they wanted to give. These ideas feed into the performance, so we end up with 5 different stories following 5 nurses whose ability to care is challenged, or their ability to care without emotional cost to themselves. And those stories play out as a series of interactions with particular patients. The fun part is that the audience is the patient.
The first performance was in our simulated ward, with the audience being in the beds. This gave us the opportunity as staff and students to experience the patient's point of view and the patient's potential vulnerability. It was interesting to observe the other side of the dynamics of the ward, of the reality how every moment is watched and perceived. The students said they often felt in the spotlight when they were working on the wards, and this was clearly demonstrated as the ward became the theatre.
The scale and longevity of the Careful project, the number of students involved, also make it a useful case study for those practising and researching theatre and thinking about the role theatre plays in relation to different sectors of society. In this case, we're thinking about a project that takes on a caring role, and a caring role towards the caring profession.
In 2018, our head of school, Dr Julia Gell, commissioned another performance of Careful, which we performed at the Rose Theatre at Kingston. Over 400 people attended, and after the show we had an interactive discussion between the students, the actors, other members of the general public, Alex, who was the director, and her brother Milton, who also wrote the score.
And all the music is sourced from hospital directly. A lot of the percussion is various objects and instruments and glove snapping in the hospital, and the thematic material is taken from an assistant's call. I couldn't escape from some sort of emotional reaction to it because of my experiences in hospital. So amongst this machinery is this sort of very tender love letter really to the nurses who were so important to me.
For me, the highlight was when the nurses managed to actually get through the patient, and the action was like showing them in unison, and they danced to that. And as they were moving, they started to move in the same direction.
We was very representative of what you see and how invested you get in your patients.
Can I come and see her? Please?
It's really good, and it brought to life things that we need to, like practical things we need to take into practice as future student nurses, like using the distraction techniques.
Is there a blue car out there? Can you see the blue car? There's a little red car stopped at the traffic light.
It was amazing. I mean, I've never seen anything like this. A combination of theatre and nursing. Fabulous.